Hello, everyone. Thank you so much for joining our Facebook discussion today. My name is Erica Hartquist, and I'm a Public Information Officer with the Health Information Center and a part of the Oregon Health Authority's COVID response team. Today, we are joined by Oregon Health Officer and Epidemiologist, Dr. Dean Sidelinger, who will talk about the newly updated guidance on reopening, and Michael Wood, Administrator of Oregon Occupational Safety and Health Administration, who will discuss how Oregon OSHA is interpreting this new guidance. After a brief presentation, we will open it up to questions from the public, and we'd like to remind our media friends that this is strictly an opportunity for the public to ask questions, and we will provide the chance for members of the press to ask questions during our weekly news conferences. To ask a question, you'll need to submit it in writing in the chat section there. And with that, we'll ask Dr. Dean Sidelinger to kick us off.
Thank you, Erica. After nearly a year and a half of COVID-related restrictions, Governor Kate Brown reopened the economy of the state on June 30th. This means that the use of face masks is no longer required in outdoor spaces such as parks or in indoor or closed spaces such as shops, supermarkets, or restaurants. I want to remind you that you are considered protected 14 days after receiving your second dose of vaccine from Pfizer or Moderna, or 14 days after receiving the single dose of Johnson & Johnson vaccine. So if you're fully vaccinated, wearing a mask is not required in most public spaces. But if you're not fully vaccinated, we recommend you still continue to wear a mask in indoor public spaces and outdoors in crowds, as you're still vulnerable to getting COVID. While many COVID-related health and safety restrictions have lifted, some still remain in place. The use of face masks is still required in the following places: public transport, such as airports and airplanes, bus centers and buses, trains, and other modes of public transportation, most detention centers for adults and youth, health centers such as clinics, hospitals, and pharmacies, and in places where the owner-proprietor requires masks. I recommend that you always have a mask on hand, just in case it's necessary. People who have not been vaccinated or have not completed their vaccination series are still vulnerable to the virus, particularly as more transmissible variants come up in Oregon. We recommend that if you've not been vaccinated or are not yet fully vaccinated, you continue to use a mask and keep physical distance in the following situations: indoor areas where you're surrounded by people you do not live with, especially if you don't know they're vaccinated, and in open places where there are crowds like fairs or concerts. The warmer weather has certainly been drawing more people outdoors. Many Oregonians continue to wear masks and limit the size and frequency of social gatherings. And most important, more Oregonians have been getting vaccinated each and every day. The pandemic is not over for those who are not vaccinated. The best thing you can do to protect yourselves, your family, and the community is to get vaccinated and help those around you make a plan to get vaccinated themselves. Now I'd like to turn it over to Michael Wood.
Hello, I'm Michael Wood, and I'm the administrator of Oregon OSHA. And we made changes to our workplace COVID rule that align very closely with those that Dr. Sidelinger just described. And so the basic message, and it's been true for a couple weeks now, is that in most Oregon workplaces, employers are no longer required to ensure that facial coverings are worn or that physical distancing is enforced. Now, that doesn't mean that they can't impose requirements of their own, but it does mean that we aren't requiring it. The exceptions to that are the same ones that Dr. Sidelinger just described: transit, certain custodial facilities, and largely the largest group are the various healthcare employers. But it's also important to realize that those aren't the only requirements that Oregon OSHA had in place, and most of our other requirements remain in place. We've had people ask why, if things have gotten better, we don't simply repeal the entire rule. And we're talking about an improving situation. We're not talking about a situation where the risk has completely gone away. So from a risk management standpoint, it makes sense to us to peel the rule off in pieces, and that's what we're doing. So first of all, it's important that with regard to masks, that employees still have the right to wear a mask, any facial covering, or to wear a respirator on a voluntary basis if they choose to do so. And then there are a number of other protective measures that we still require. The basic planning around infection control and training, the basic cleaning requirements are still in place, and the requirements to notify other employees when somebody has been in the workplace who's been exposed. Our ventilation requirements also remain in place, which essentially require employers to get the most out of their existing ventilation system. And then in certain healthcare facilities, there are still individual screening and triage requirements. There's also, importantly, the continuing expectation that employees be enabled to stay home when they're sick, particularly when they're looking at the risk of COVID. And so if they need to isolate or quarantine because they potentially have COVID, consistent with the public health guidance at the time, then the employer needs to not only allow them to do that, but actually tell them that it's expected. And at the same time, the employer needs to ensure that they have the ability to return to essentially the same duties when that medical removal, as we call it, has been completed. So that's really the basic message is we've largely returned to normal. In most settings, we don't have to wear masks or distancing, although in many cases, it's still a very good idea. But there are a few requirements, particularly targeted at the workplace, that employers need to continue to pay attention to, and that I'm sure will be on the books, at least to some extent, for the next 5 to 6 months. And with that, I think we're ready to turn it over for any questions that we may have.
Yes, thank you so much, Michael and Dr. Sidelinger, for both of your introductions. We're now going to open the live chat up to questions. And this is a reminder for everyone that this is a live Q&A on Oregon reopening. So we won't be taking questions on other topics today. Again, to ask a question, please submit it in writing in the chat section there. And our first question comes from Sarah. Sarah asks, can businesses still require face coverings?
The answer to that is absolutely. Businesses still have the ability to control the events in their workplace. And if they choose, for the comfort of their customers, for their own comfort, for the comfort of their employees, or just because of their recognition of the risk, to impose requirements that go beyond the minimum standards that we require, they absolutely can do that.
Great. Our next question is from Veronica. Veronica asks, how is it safe to lift restrictions if children under 12 still can't get vaccinated?
Thank you for that question, Veronica. Children under 12 are still not eligible for the vaccine. We know that some other members of our community, those who are immunocompromised, may not have full protection after getting vaccinated, and still others are not yet vaccinated for other reasons. These individuals are still at risk for COVID. What we know now is that there's less COVID circulating in the community than there were earlier times during the winter when we saw our surge, and even this spring. But with more transmissible variants, cases may increase. So even though masks are not required and some of these other restrictions have been lifted, we expect families to still consider the choices they're making, whether it's limiting the play dates that they have with their younger children who are not yet vaccinated, moving activities outdoors because it's safer, or continuing to wear masks in outdoor crowded places and in indoor spaces because members of the family aren't vaccinated. So individuals and families will be making those risk assessments and deciding on their activities. Our local partners and local governments may also look at rules that they could put in place in their communities because of higher COVID rates or other local conditions. So even though most of these requirements have gone away, there are still some recommendations that people need to think about to protect themselves and their families when they're not fully vaccinated. And that could include still wearing a mask and still limiting their activities.
Thank you, Dr. Sidelinger. Our next question is from Jolene. Jolene asks, which types of businesses still need to enforce face coverings and social distancing?
That's an important question because it reminds us that the restrictions haven't gone away entirely. And the short answer is that you should expect to wear a facial covering whenever you're engaging with a healthcare provider. You should expect to wear a facial covering whenever you're using transit services. And then there are certain custodial facilities where they'll be expected as well. But I also want to emphasize something that Dr. Sidelinger said earlier, which is you really should keep a facial covering with you at all times. That way you can deal with a business that expects it. And you can also deal perhaps with the situation where you step onto an elevator with an individual who's wearing a facial covering and looks uneasy or doesn't. I consistently ask in those settings, or I just put my facial covering on, as much for their comfort as for their protection. But part of it's just being a good neighbor.
Thank you, Michael. Laura is asking, why aren't we following CDC or WHO guidelines? Vaccinated people are not as contagious, which is not the same as things being, quote, perfectly safe.
Thank you for that question. I think, when we think about our World Health Organization partners, our Centers for Disease Control and Prevention partners, they are making recommendations and guidance that need to cover multiple communities with different levels of transmission, different levels of vaccination. And in Oregon, we have the same thing. We have counties and communities with different levels of transmission and different levels of vaccination. So we look at that guidance and we implement recommendations such as that individuals who are not fully vaccinated should continue to wear their masks in indoor public places and outdoors when in crowds. That outdoors, where the virus dissipates quickly, individuals, even those who aren't vaccinated, if they're outside in a park or hiking and may come across people but not be in a crowded setting, their risk is very low, so they don't wear masks. So we make recommendations about where masks should be worn to best protect those individuals who are unvaccinated. We know that certain settings, like healthcare settings that bring together people often who are sick, who may be immunocompromised or have underlying conditions, and the healthcare providers that are providing services to them can be a higher risk for transmission. So the masks are still required in those settings. Public transit with closed indoor spaces with multiple individuals from multiple households also present a higher risk. So masks are still required in those locations. So I think if you look at the approach with our recommendations here in Oregon from OHA, our requirements in Oregon from our partners at Oregon, OSHA, OHA, and others, they do follow recommendations from our national and international partners to try and offer the best protection. Again, vaccines are highly effective, but they are not 100%. But an individual who is fully vaccinated, who's not immunocompromised, is at very low risk from getting the disease and is also at low risk to transmit it to others. And so that's why the recommendations of who should wear masks in certain settings differ between vaccinated and unvaccinated individuals. We also encourage, as we've talked earlier, that businesses can require masks in their settings to protect their employees, their customers and clients. Individuals can make that choice as well. So whether you're not vaccinated, you're immunocompromised, or you're just kind of anxious after having worn a mask for the last year and a half when you go to the grocery store, you can still do that. That will offer you an additional layer of protection, even if you're fully vaccinated, but that vaccine really does offer you the best protection against COVID right now in Oregon.
Thank you, Dr. Sidelinger. Vicki is asking, if masks aren't being required in restaurants, butcher shops, and other places that handle food, what's keeping the saliva droplets that spread COVID out of food?
Thank you, Vicki. I will say, certainly we know that COVID can spread via droplets on surfaces. But what we've determined over the last year and a half is that's much less likely than COVID being spread through droplets in the air or just airborne transmission from one person to another as they talk, if they cough or sneeze in close proximity to others, particularly in indoor settings. For butcher shops and restaurants and supermarkets where people are handling food without masks, even if there are some droplets on that, the routine washing of that produce can help get rid of COVID. Cooking that material can also get rid of any COVID that's potentially on there. And we're not seeing food or eating food as a real mechanism for transmission of COVID. So it's safe, to eat that food in a restaurant. It's safe to eat that food you brought home from the grocery store. Just take the regular safety precautions you normally take to wash that food and to cook that food thoroughly to get rid of other things that can potentially cause illness from that, but it's not going to be COVID.
Thank you. Our next question comes from Adriana. Can counties create their own COVID-19 safety and health restrictions?
Certainly, I'll take that one. The same way individual states for most of this pandemic have been creating statewide requirements for how to control the spread of COVID in their communities. Local communities can do that as well. When we got to June 30th and then reached the goal of 70% of adult Oregonians receiving at least one vaccine, we know that transmission in Oregon is lower from the high vaccination rate and from the summer months as people spend more time outside, but COVID is not gone. And we know certain communities have lower vaccination rates and higher rates of COVID transmission right now. And that could accelerate with the increase of variants that are more easily transmitted from one person to another. So local officials, county commissioners, and judges who run facilities can consult with their local public health authorities and administrators and decide if, based on the conditions in their community, more requirements need to be put in place, and those elected officials can make those decisions and put those in place. A similar process will exist around schools. As schools implement guidance in the fall, as students return to and teachers return to campuses, they can choose to put more requirements out of that guidance rather than just the sole requirements that are in place right now.
Thank you, Dr. Sidelinger. Our next question comes from Craig. What about healthcare facilities with regards to social distancing in waiting rooms? Can we use less than 6 feet while face masks are worn and there are no acute patients allowed in the clinic?
I don't want to steal all of OSHA's thunder, but I think we've worked very closely with OSHA on this, and we know that healthcare facilities, we still have requirements in place around face coverings that protect the individuals who work there that come out of OSHA, and requirements for patients to wear masks in those settings. In settings, we look at multiple layers of protection. So improving the airflow as much as possible, wearing masks in those settings. If people can be kept further apart, great, but there's not a requirement for people to be kept 6 feet apart or more in waiting rooms, but it's these other layers of protection that can improve safety and decrease the risk for transmission in those settings. But again, another tool we have is that for those providers who work in those settings, they should consider getting vaccinated if they're not already vaccinated, and promoting efforts to get the patients and the clients you serve vaccinated so that everyone has a higher level of protection.
Thank you. Our next question comes from Sean. Do group homes with 3 individuals being supported by a DD provider fall into healthcare settings? And if so, why?
I'll go ahead and take that one because the healthcare settings issue really is a significant component in the context of interpreting the Oregon workplace rule. And the answer is no, they don't. Now, it's important to recognize that separate and apart from our rules that apply to workplaces, there are licensure requirements that exist in a variety of settings. And it's possible that there will be a regulatory framework there that is separate from the one that we impose. But a DD provider in a group home is not in a healthcare setting and would not be addressed by the Oregon OSHA rule.
Thank you. And this perhaps could be a follow-up, Michael, here. Tom is asking, how is healthcare employer defined?
So in our rule, healthcare settings that are covered by the more stringent provisions of the rule, including now masking and distancing, are defined by the fact that direct patient care is occurring. So it doesn't relate to, the billing office in a hospital, for example, although that's clearly a healthcare employer. It doesn't relate to those situations where there isn't direct engagement with patients and direct patient care occurring. We're really very focused on those situations where there's an engagement between the healthcare provider and the patient. When we talk about healthcare setting, that's the context that we're addressing it.
Our next question is from Ken. If everything is reopened, why are we still required to wear masks for transportation and medical appointments?
Thank you for that question, Ken. I will say, with the reopening, what this meant is that most of the statewide restrictions on business capacity, on mask requirements, and on physical distancing have been lifted. Individual communities, individual counties may decide to put in more stringent requirements, but reopening does not mean that COVID has gone away. We still have COVID circulating in our community. With variants out there that are more easily transmitted, we will likely see an increase in cases. And we know that not every eligible Oregonian has been vaccinated. And so there are still people out there who are not vaccinated. And we know that there are people, children under 12, who are not eligible for the vaccine. So while we have reopened and businesses can serve customers at full capacity, and that masks don't need to be worn in most businesses, with the exception of some things, that COVID is still there. And those requirements for masks on public transportation and in healthcare settings are there because those are settings that bring together either people who are more vulnerable to the effects of COVID or may be more likely to be immunocompromised or sick with COVID, like healthcare settings, or public transit, which brings together multiple people, often in a small enclosed space for long periods of time, where COVID can be transmitted more easily. So masks help offer protection in those locations for those who are fully vaccinated, and most importantly, for those who are unvaccinated or for those who aren't fully protected from the vaccine for medical reasons.
Thank you, Dr. Sidelinger. Catherine would like to know.
I think Michael would like to add to that.
Oh,
sorry.
More from Michael. Go for it, Michael.
Add to that we have somehow we've allowed the word reopening to take on an odd meaning. Continuing some caution and some restrictions, including the use of masks in situations like public transit, isn't an indication that something's not open. It's what we need to allow ourselves to be as open and really fully reopened as we are. And I think it's important that we view it in that context, that a continued awareness, continued caution, a continued push to get more people vaccinated is important to continue to protect people, including workers. But that doesn't mean that we have to have closures of the sort that we were looking at a year ago in the spring and then beginning again last winter.
Thank you both very much. Catherine would like to know, what's the plan to protect the immunocompromised children and others who can't get vaccinated at this point?
Thank you, Catherine. As I stated before, COVID is still in our community, and so individuals are making choices each and every day, often hour by hour, about the safety guidance they'll take. Let me take a family that has young children under 2. The parents, are eligible for vaccine and hopefully have been vaccinated, but they know that their children do not yet have that protection. They may choose to limit the types of activities they participate in. They may choose to move activities outside where transmission is lower. They may choose to continue with some of the limited social interactions and play dates that they've had with their kids over the last month or over the last year that COVID has been here and in our community. So individuals will make assessments about the risks that they're willing to take, the exposures that they're willing to have. And I would hope that they still continue to wear masks. Parents may model that for their younger children if they're going to an indoor setting where they don't know everyone's vaccination status, and they know that their children are not vaccinated and the other young children there are not vaccinated. So individuals and families will still make that choice. Businesses may make a choice to say, hey, we know that there are members of our community, whether our employees or our clients and customers we serve, that are not yet vaccinated, or we serve a population that has many customers or clients or employees with immunocompromising conditions. They may choose to still require masks in those settings. And then again, local public health, working with local decision makers, those local decision makers may implement more stringent requirements in places. So the tools we have to protect those who are immunocompromised and those who are not yet eligible for vaccine continue to be available. Wearing a mask, keeping distance, and limiting the type of indoor large gatherings. And so families are navigating that every day, and individuals with underlying medical conditions are navigating that every day, and they'll continue to make those decisions.
Thank you, Dr. Sidelinger. Troy is asking, could restrictions be put back in place if we see a surge in cases due to the Delta variant?
I will say, we've learned a lot during this pandemic, and the more we learn, the more we know that this pandemic, this virus can change. So while nothing is off the table, we know that we have very effective vaccines, including the vaccines that we have work against Delta and the other variants we know that exist right now. So our best tools continue to be to get vaccinated. If you're already vaccinated, thank you. If you're not yet vaccinated, make a plan. Reach out to trusted sources to get information to help answer your questions. If you're vaccinated and you have friends, family, or loved ones that aren't vaccinated, try and help them, direct them to trusted information, or help them get an appointment or get transportation to an appointment or other things that may be standing in their way. Masks and physical distancing will still be there for those individuals not yet vaccinated for various reasons. If disease increases significantly in Oregon or in the United States and hospitalizations are increasing where we get to a point where people may not have access to the quality care they deserve, we'll certainly talk about, do we need additional measures in place? But right now, we know that individuals, communities have the tools to protect themselves and their friends and loved ones, vaccinations, wearing masks, keeping distance in certain settings, and that can keep transmission low in Oregon, keep people safe, and keep Oregon as a leader in having one of the lowest case rates and lowest fatality rates amongst COVID, in this country. COVID is still with us. COVID could change and recommendations could change, but for right now, I thank Oregonians for all the sacrifices they made. Oregonians who've been vaccinated, all of these steps have helped protect Oregonians and will continue to protect us going forward.
Thank you, Dr. Sidelinger. Our next question comes from, and I hope I'm pronouncing your name correctly, Denise. And that question is, in the healthcare setting, are masks required in non-patient areas, such as the nurses' stations?
So I can take this one because I'm probably responsible for glossing a bit and generating it. While it is patient care that defines a healthcare setting in our eyes, once you're looking at patient care, that broadly applies to the overall setting. So certainly the nurses on a patient floor are engaged in patient care in a patient care setting, even in those moments when they're not directly in contact with patients. So the nurses in the nurses' station would need to be wearing facial coverings to protect one another under the existing rule.
Great, thank you very much, Michael. Our next question comes from Wendy. Are there indicators, for example, hospitalizations that would bring back restrictions? And if so, what are they?
Yes, thank you for that question. I think we're constantly monitoring the data, and there's not a set point where we say this is when restrictions would come back. Right now, we know that in spite of these more transmissible variants, what we're seeing in Oregon is that vaccines have made a huge difference. Individuals who are getting sick, individuals who are being hospitalized, and individuals who are dying in Oregon are very, very likely to not be fully vaccinated. If you're fully vaccinated, those individuals represent just a tiny fraction of the individuals getting ill, the individuals being hospitalized, and the individuals dying. But we continue to monitor cases and how they're transmitted in Oregon. We continue to monitor patients in the hospital with COVID and capacity of our hospitals to serve everyone. And we continue to monitor the spread of variants such as Delta that pop up in other communities before they pop up here, and look for variants that may occur here. So all of those things are taken together, but that's why we encourage people to still take some steps to protect yourselves, your families, and your loved ones by getting vaccinated and taking other precautions in settings where you're not vaccinated and maybe in crowded situations by continuing to wear masks. I think, COVID is still here. And even though we're reopened and capacity limits are lifted, we all have some measure to protect each other. We saved thousands of lives here in Oregon by the sacrifices we made by continuing to get vaccinated, and we can be very proud of that. The people that we've lost to COVID can never come back, and my thoughts go out to the friends and families who've lost loved ones. but we need to continue to take precautions so that we don't continue to lose people to COVID-19.
Thank you, Dr. Sidelinger. Okay, our last question comes from Charlene. And Charlene says, patient care, does that include dentists, chiropractors, and naturopaths, etc.?
When we talk about healthcare settings, we talk about the broad breadth of healthcare settings. So that's from inpatient settings, congregate care settings like skilled nursing facilities, outpatient settings, and the parts of pharmacies where they're providing direct care, whether it's giving vaccines or checking blood pressures, and all of the healthcare providers in those settings, the nurses, physicians, pharmacists, medical assistants, and others who are part of providing care do continue to wear masks. That includes our dentists, our chiropractors, and our naturopaths that you asked about in those settings. If you're coming to a setting and getting healthcare, you will see individuals required to wear masks, the providers and the patients and customers that they serve. I think with that being our last question, I want to thank you all for tuning in, for asking questions, and I hope you found this informative. We'll continue to do Facebook Lives to try and answer your questions. As we've reopened, this is an incredible milestone here in Oregon that's a testament to all of the sacrifices we've made trying to fight this virus. From our my public health partners at the state, local, and tribal, and our federal partners, our healthcare providers, but all of the business owners, employers, employees, and just general Oregonians who are out there have been making sacrifices to fight this virus. The virus is still with us, and so getting a vaccine is your most important effective tool to prevent spread of this disease and prevent you from getting sick, possibly being hospitalized or dying. So if you haven't been vaccinated, please make a plan to get your vaccine. Help your friends and loved ones make a plan to get their vaccines. And if you're unvaccinated or have children in your home or you're immunocompromised, you continue to take precautions. Have patience and grace with your fellow Oregonians. If people feel more comfortable wearing a mask, if a business is requiring a mask, follow the rules, follow your instincts, and give folks some space if they ask for it. So thank you for tuning in. I hope this was informative. We look forward to talking to you again soon.